Hello, and welcome to our second installment of Lunch and Learn. I hope that you all are off to a wonderful start to the week and that you are ready to learn something new and unique about your body. So, this week we are covering Pelvic Floor 101, aka what the heck is a pelvic floor. In hindsight, I probably should have done this video first, but live and learn. So, I have my handy dandy pelvic model today. This way we can have a visual representation that we can refer to and to just give you an idea of visually what's happening in the pelvis. Okay, so to start off with, the pelvic floor is a group of muscles that are located in the pelvis, as you can kind of see here as well as underneath. They almost kind of look like a hammock or a bowl. See how it's kind of a bowl shape there. So within the pelvis, this acts as a floor to the pelvis, basically. When managing breathing and body mechanics and pressure systems, this is like that base of support. But more on that later. So just for some general anatomy review. So this white part that we see here, this is that bony anatomy. That's the pelvis itself. And you can see in the back here, we have the spine that comes down into the sacrum and the tailbone. And then you can see even where the pelvis, this back part of the pelvis, attaches onto the lower part of the spine or the sacrum, okay? And then in the front here, we can see where the pelvis actually comes together, and this is kind of what we would call our pubic bone in the front. Another thing I like to point out too here, so these are like the sit bones. So if we're looking at this way, when we're sitting down and we can kind of feel like when you shift side to side and you feel something kind of pokey, those would be your sit bones. So as we look at where the muscles lie, we can see that they basically start kind of from the tailbone and that they kind of come out and across all the way back to that front part of the pubic bone. So they're kind of spanning, again, bowl shape within the pelvis. Another important thing that I would like to point out as in addition to the actual bony and muscle structures, we also have some of the openings here. So this is a female pelvis model. So here we would have the anus, the vaginal opening, and the urethra. And we can see too, kind of important thing, how the muscles come around and also kind of cross-section and attach to those vaginal, anal, and urethral openings. Okay, so there are three main layers of musculature that make up the pelvic floor, which we can assess both internally and to a degree externally to see if there's tension in the muscles, if they're able to contract and relax, and just what the integrity of the muscle structure is. Another important thing that I want to mention here too is that obviously, this is a pelvic model. It's not like what's actually sitting within our body because we also have our pelvic organs. So what that looks like, we have bladder that sits in the front, vaginal opening into the uterus in kind of the middle, and then rectum in the back. So this actually sits within our pelvic floor, or within the pelvic bowl, and it's not gonna be all pretty and nice looking, but you can get a general idea kind of what that looks like as far as what's happening from a support standpoint. So see how all those organs, again, bladder in the front, vaginal opening to uterus in the middle, and then the rectum in the back. Okay? We'll kind of touch on that more. So that's just kind of an idea of the general anatomy of the pelvic floor. And then from a functional standpoint, the pelvic floor has some pretty important functions when it comes to support in the body. So they work to support the pelvic organs, kind of like we just talked about. So again, bladder, uterus, and rectum keeps them from just falling out of your body. I think we can all agree that that would not be ideal. The pelvic floor also provides support to help control urinary, bowel, and sexual functions. So for example, when we contract the pelvic floor, we're actually closing some of those openings as far as being able to close off bowel and bladder to hold in urine and poop. And we have to be able to relax the pelvic floor in order to let urine and poop come out of our body. Finally, pelvic floor provides stability to the pelvis, to the spine, and it just acts as the floor to our core, okay? So these functions are super important, and dysfunction in the pelvic floor can cause disruptions in any of these symptoms. So this can look like urinary or fecal incontinence, prolapse, pain in hips, back, or abdomen, constipation, pain with penetration, and more. So one of the unique things about the pelvic floor is that it's not something that we can or that it's not something that we should necessarily be thinking about throughout the day as it's like functioning, but it's always on and it's always doing those functions that we mentioned before from a support standpoint. Another kind of neat thing about this, neat-ish, is that it can make it really difficult when we're trying to heal or rehab. Since you can't just rest the pelvic floor for 6 weeks and give it a break, you twist your ankle and you can wear a brace, you can use crutches, you can elevate, you can rest it until it heals, and feels better. Meanwhile, women give birth and potentially have tearing or just other disruption, or someone has a pelvic floor flare-up with chronic tension. You can't just turn off your pelvic floor for 6 weeks to let it rest. So, this makes it a little bit more challenging, but it's also important because it can bring a lot more attention and hyper focus to the symptoms because we use our pelvic floor so often. If you're experiencing pain or heaviness, there's a constant reminder throughout the day that that's a problem. And this can be aggravating to that sympathetic nervous system that we talked about last week and perpetuate or even exacerbate symptoms further. Basically, what this means is that it requires a different type of rehabilitation. And this is where seeing a pelvic floor PT comes in. So if you are experiencing any of those symptoms, pain, heaviness, leaking, constipation, hemorrhoids, pain with penetration, UTI-like symptoms, pudendal neuralgia, the list goes on, please look into pelvic floor PT. Try to schedule an evaluation or a consultation. You can reach out to me and I can answer any questions that you might have. Pelvic floor PTs are the only providers that are specifically trained to actually assess and treat the pelvic floor. So there are treatment options for these symptoms, and it's not something that you have to continue to live with. So again, please, if you're experiencing any of those things, look into what some options might be to improve it and make it better. So that's just a little brief, quick thing about what the pelvic floor is, what it looks like, and how it provides support, again, pelvic organ support, bowel, bladder, sexual functioning support, and stability to the pelvis, abdomen, and hips. So I hope you enjoyed this week's Lunch and Learn. Now you know about your pelvis and your pelvic floor. So have a great rest of your day, and I'll chat with you next week.